SOS call not successful. Call 911.
All right, we're going to go for it here. Just giving Joe another couple of seconds here. All right, Joe, you're good to go? All right. Thank you so much for being here with us and for your interest in learning how to expand your team with virtual assistants. It's really an amazing area of interest right now. It's something a lot of people are talking about. And I'm so excited to be able to work with Joe and provide this information. So by way of introduction, I am Bethany. I am CEO of the Power Practice Management Consulting Company. I also have 2 practices in New Jersey, part owner of 2 practices in New Jersey. And between those companies, the employer of 7 virtual assistants. I'm a big fan, maybe slightly addicted, and have 5 of those working between the practices and 2 working with us on our Power Practice team. Joe, I will let you introduce yourself and then we will get started. Oh, but you're on mute.
Had to unmute me again. Hi, Joe Deloach. I'm CEO of Practice Compliance Solutions, and I'm really excited to do this one. This one's one of the more interesting topics I think I've been involved with in a long time. I think you'll get the gist of it as we kind of present this whole thing about, you know, what is working, what's not working, and what we don't know. But it's really exciting to dive off into novel ideas, and so I think you're going to find this presentation to be really interesting.
So has this happened to you in the last 30 days? Because it's happened to me, that you go to get your coffee in the morning and find that the coffee shop that you go to every single day and expect to be open one morning is suddenly closed. Not for good, just for that day. Or maybe it's open, but only the drive-through, or open, but you can only go into the store and you can't go through the drive-through. It's happening sporadically, but sporadically consistently. I was at a hotel last week that had breakfast service, and they said breakfast starts at 6:30 a.m. And my colleagues were at breakfast at 6:30 a.m. when it opened, and the restaurant was closed. And they were told, oh, the server's not here yet. And they waited, and the server got there about a half hour later, and the restaurant opened that particular day around 7. I've stopped in restaurants that look empty, that you go in and you think, oh, great, there's no one here. To be told that there's a 30 or 40-minute wait, looking at all these empty tables in a restaurant because they don't have enough wait staff or chefs or dishwashers to keep the restaurant running the way that it's supposed to. And it feels like walking through almost any town or city, almost every business on a main street has some kind of help wanted sign in the window. This is what's going on in our country right now, across the country. There are fewer people looking for work. There are fewer people looking for different jobs We used to post an ad for a receptionist. We'd get 120 applicants the next day, and we'd have our pick. And now we can post that same ad, and sometimes, depending on the week, get six applicants. Sometimes 10. We get really excited when they're 20. And what we find is those 20, because of what's going on in other businesses, have much higher demands than employees did before. I was in Jacksonville, Florida at a client's practice. We stopped at a Buc-ee's because the person I was traveling with had never been to one before. Truthfully, I had never been to one before, but somebody had hyped it up. You have to go to Buc-ee's. And this was the sign outside that they're starting people in food service at $20 an hour. The benefits that companies are offering. One of my daughter's friends' moms was telling me, "So did I tell you I'm working at Starbucks now?" "Okay, I didn't know you were working there." She said, "Yeah, I'm able to get health insurance for my whole family as a part-timer. I work 22 hours a week." Companies are offering college educations, free college credits, and the flexibility for a lot of people to work from home, to work 4 days a week, or to work the hours that they choose. And these are things that our optometric practices really can't feasibly compete with. So it's led people to get creative. And if we can't find people who are looking for work in your community, people are starting to look outside of their community, sometimes outside of their state, and even outside of their country for help, which is what the interest is now in virtual assistants. So a virtual assistant is someone who provides services, usually administrative services, not always, but they're not working in your office. They're working from their home or their co-working space or somewhere else that's not your office. There's some that work project-based. They do short-term project, and some that work ongoing. I have friends and colleagues who have had virtual assistants for 5-6 years, the same person working as an employee of the company. Our longest tenured VA at the moment is about 2 years. It's not a brand new concept. Tim Ferriss wrote this book, The 4-Hour Work Week, I think in 2007. And in the description for the book, it is directions how to outsource your life to overseas virtual assistants for $5 an hour and do whatever you want. So this is a concept that's been around for a while. We probably hired our first virtual assistant. After I read this, I was inspired. That was probably 12, 13 years ago. It was horrible. I'll tell you more about it later. I've gotten better. But this is not a new concept. But because of what's going on in the current labor market, all of our offices being short-staffed, not being able to find local people, we're seeing a resurgence in the interest in virtual assistants in optometric practices. All you, Joe.
I can just tag along with that, and probably some of the people listening have our PCS clients, and we've actually been in your office to do compliant on-site overhauls and things. And the PCS teams have been in something in the neighborhood of 11 or 1,200 offices over the past several years. Beth was talking about the coffee shop, having a sign up. Almost every single office we go into is looking for help. So this is not a coffee shop problem or a restaurant problem. It's a huge problem in optometry practices, and I probably in healthcare in general. I don't think this is just hitting us. So the reality is, as Bethany described, we're in a very, very changing employee market. and novel ideas tend to grow out of that. And I would contend that much like other technology, whether it be, diagnostic technology or what it is, we're going to have to roll with the changes and see if these things work for us. Now, from my side of the equation, I live in the world of compliance. So when I put an eye on these things, my number one thought is, can we stay out of trouble? Is there is there a swamp here that I'm going to step in? So we're all about avoiding the pitfalls and avoiding the swamps. So you have to really kind of look into these things and make sure that we're doing it the right way. I can tell you right up front, you will hear a lot about some of the obstacles you have to think about, but none of the obstacles are stops, and none of them are anything you can't overcome. But when you march into unknown territory, you do have to be cautious. When I talked to one of our HR attorneys that we have on council, he sent me an article, and the article was remote workforce, out with the old and in with the unknown. And that kind of sums it up, because we are in territories that just don't have answers. Legislation wasn't, written 5, 10, 15, 20 years ago to address some of these questions that pop up. So we just have to be cautious. And like I said, we have to look before we leap. And we have companies that are forming that, have kind of done some of the homework for us. So they're trying to present a product that's safe and satisfies this need. But from my end, we just have to be cautious and make sure we're doing it the right way, so that no one gets hurt by this. And like I said, it's very doable, but there's some check marks you're going to have to make if you want to make sure that you're all completely safe on this.
Joe, this I'm laughing because this so sums up our roles here. I came in saying this is a love letter to virtual assistants, and you've got this, we need to look before we leap. And I'm thinking of a magnet I have on my fridge that says leap and the net will appear. So I think that there's a benefit to us doing this together. Go ahead and continue.
No doubt about it. So just to kind of follow up on Bethany talking about virtual assistants, and we definitely want to make sure we're looking at this the correct way, because virtual is virtual. And sometimes when I hear people talking about, virtual assistants, this is the world of remote work. And many of the things we have to consider and deal with, it doesn't matter whether your remote worker is across the street or in the next town or in the Philippines. The issues really are the same. Some of the obstacles are the same, no matter where they are, because the point is they're not under your roof. And that creates some things that you have to think about. Now, I will say that when we move outside of the United States, there are some additional questions that come into play that you have to think about. Again, obstacles that can absolutely be checked off, but there are some things you have to think about. And I think it leads to finding the right company to work with to help you with this. But there are just contract issues you have to deal with. We're going to talk later about some HR issues. And what really kind of started the whole conversation between Bethany and I was really how all this relates to HIPAA. And so we will spend some time on that, because that is absolutely a consideration when you tend to, in some ways, lose control of privacy and security. But there's many ways to kind of hold on to that control as well that we'll talk about.
So as Joe mentioned, virtual assistant can be anybody not in your office. And we've had some US virtual assistants, but the interest recently is really in overseas virtual assistants. And these are people who live and work outside of the country. And some of the benefits of virtual assistants who are working outside of the country, first is the availability of the workforce. When we're looking to find a virtual assistant, depending on the path that we choose, very often I can have the idea in the morning that we need a new virtual assistant for something and have somebody to interview that afternoon or within the next few days. People have shared they see a different work ethic, not to make sweeping generalizations, but making a sweeping generalization, a different work ethic in people from outside the US. You're able to hire people, more people available with specific skill sets. There are people who've hired virtual optometrists, not necessarily for optometric work, but to scribe. And in some cases, a scribe position in the US pays more than an optometrist position outside of the US. So one of the huge benefits of overseas virtual assistants is the salary requirement. It's a fraction of US salary requirements. And in addition, it's just pay. They're responsible for their own taxes. So it's not the pay, taxes, benefits that you're paying for someone here. One of the other benefits I like is depending, again, on the virtual assistant and how they're hired, very often their pay is paid on a credit card. So we're racking up miles. One of our virtual assistants is getting married in the Philippines in the spring. And my partner who she works with, she's his scribe. He's hoping for an invite to the wedding. And if he gets invited to her wedding, we have enough miles for him to go that have come from just paying the VA's salary. And an interesting benefit that I hadn't thought about, but I'm enjoying, is that it's an opportunity to learn about different people in different places. It's, I didn't know that there were parts of the Philippines that were a flight to get from one end to the other. I've got a typical US narrow-mindedness, and I've enjoyed getting to know people from outside the area.
Bethany, if I could say something right there, I think there's a misconception there as well, that this overseas workforce, I won't go so far as say doesn't have any training, but most of the times, especially these companies that vet these prospective virtual employees, these are degreed people. These are healthcare degreed people times. You mentioned the virtual optometrists. I mean, these are nurses. These are people that really have a very defined skill set that meets, what we're looking for in many ways. So I think there's sometimes a misconception that these people aren't really, trained, and they really are.
Absolutely. Hello, Rach, who's sponsoring this webinar. All of the virtual assistants that they hire out are nurses or pharmacists. So these are absolutely people with healthcare background and advanced degrees. I think another misconception that people have is that you're taking advantage of the virtual assistant by paying the salary that you're paying. And it's been interesting. I did a podcast episode with a virtual assistant to hear what is that the case? What is this for them? And this is something that for them is an opportunity. It's an opportunity to work and grow in a US company. It's an opportunity for more money. The position here just pays more than the position that they were in before. In a lot of cases, they're concerned about stability. And so here you have a great employee doing anything virtual or otherwise. It's very unlikely that you're going to let them go. And for some of them, it gives flexibility. Some of the virtual assistants I've interacted with are parents who have children, they want to be able to work our hours so that they can be home with their kids during the day, work the overnights. And that's something that they're looking for in a job. So as Joe mentioned, there's multiple ways to hire, and he's going to talk more about these, but you can hire a virtual assistant directly. There are websites that match or that have posts of virtual assistants looking for work. You can post a job and you can find your own without intervention from anybody else. There are agencies that exist to pre-vet some people to say, this is, these are nurses, these are pharmacists, these are people with some degree of HIPAA training. And then you can hire a company that tells you that they are using remote workers, who says, we're responsible for their training, we're responsible for measuring their success, we're responsible for measuring their outcomes. So the considerations are different with these, and Joe, I'll let you speak to those.
Yeah, this is where we get into, both contract and HR considerations. And, Bethany was saying there's several ways to go about this. So the first question you have to answer is, who am I doing business with? As she said, it may be an employee, like they operate like an employment agency. They may be operating more like just a payroll company. You can negotiate with an individual, but you see, I've highlighted a corporation. So one thing that we have to kind of establish up front is, you may be dealing with a virtual assistant in anywhere, any foreign country or Idaho or wherever. I could say California, they're more of a foreign country. But the point is, in the HR world, they're working for you in your state, and the compelling laws are no different than your office manager that's in the office next to you. The laws that govern your relationship with a virtual assistant are predominantly those of the state in which you reside. There are pros and cons of several of these different kind of contracting situations that I'll really get into more when we talk about the HR implication. But I would contend, if you're worried about, dealing with laws that you don't know, whether they be in India or the Philippines or wherever, Google's a pretty wonderful thing. It's not always accurate, but you can get some good information there. And if you Google, you can literally, it's pretty smart. You can say, what countries have employment and contract laws that are most favorable to a virtual assistant relationship? You're going to get the same answer predominantly over and over and over. And I know we've said the Philippines about 4 times now, but if you Google it, you're going to find that's the number 1 that comes up every single time. So they literally they've kind of developed a system there that is very, non-conflicting with this whole concept, and makes it a whole lot easier for you to not have to worry about some of these issues. Not the only country that's doing a good job, but it's interesting that when I Googled it several times, they tend to always come up with the same answer. Being a strict compliance type person, just like any other kind of concept or contracting situation, more so when we're dealing with more novel types of things, a look with an attorney is probably worth a little bit of check you have to write to them, just to make sure that you're, covering all the bases. So I would encourage that. So here's the swamp, as I call it, because HIPAA is pretty easy to deal with. HR is a little swampier, so there's more questions here. And that's where you get these articles written about, welcome to the unknown. But when we go back to, who you might want to do business with, and I'm really not going to side with one particular option or the other, although I kind of am. There are pros and cons of each of these situations. When you're dealing with an employment agency, again, it doesn't matter whether the employment agency is dealing with employees in Ecuador or in Texas. They're an employment agency, and the laws related to an employment agency can be quite different than some of these other options. I don't have it as one of my most favored ways to go about this, to be perfectly honest. And one of those reasons is point number 2, called joint employee. So joint employee is absolutely the swamp you have to avoid. And again, this is true whether you're hiring somebody across the street or in another country, because there's something called this joint employee concept, which means they're not only working for you, they're working for somebody else at the same time. And it's a controversial area of HR law, and one that absolutely is totally fraught with complications, both from a standpoint of tax implications, from a standpoint of kind of legal issues like workers' compensation. And, I'm thinking, well, why are you worried about workers' compensation when my employee is not in my office and working in? Well, it's because in these joint employee situations, those laws can carry forward all the way to Ecuador, all the way to India. And not only that, but some of these other countries have written laws about workman's compensation and liability issues. It gets really sticky. So that's why I don't favor that kind of choice. You probably are the best one to handle this, but inside you would be some of these companies that act more like just a introduction and payroll. So they're like almost like like we use a lot of Indeed. You may have done job searches on Indeed. It's a job search site, and they have people, and they've vetted them at some level, and you get introduced to them. And if you hire them, they work for you. So that tends to be the better way to go about this. But now the next question you have to ask is, who are they going to work for? Do they work for me, or do they work for themselves? And I would strongly advise that the best solution in these remote worker situations, if it's legal, and that can get complex, but the virtual person being an independent contractor or working for themselves is absolutely the least swampy way to go about this. And I know that, I think this is a good deal of the way our generous sponsor of the program works. But that avoids employer issues. And the reason you kind of want to avoid employment issues is because depending on what country they're from, you start mixing employment laws. And that's where this thing turns into a real bad swamp. So if you can hire these people, and basically you're hiring them on an independent contractor basis, then that is absolutely, in my opinion, the best way to go about this. Now, why is that complex? It's because HR laws define what qualifies someone as an independent contractor. So there's just a little loophole, and it's not really a loophole. It's just the way the law is written. Independent contractor laws are dealings between individuals. So I want to hire Bethany as an associate, and I can hire Bethany, or Bethany can be Bethany's fill-in service LLC. Now Bethany is no longer an employee. She can actually be an independent contractor, because I can contract with a company, but the independent contractor laws really are written about contracting with individuals. So the whole HR thing gets sticky, but again, the more you can stay away from anything but independent contracting, I think that's the best way to go. As I said earlier, the HR laws governing your relationship, whether it's a employee situation or an independent contractor situation, the predominant laws are those in which the state that your business is in. So this is one more time that you really need to be acutely aware of individual state laws related to HR. No different really than you should already with your current in-house workforce. We talked about the liability issues a little bit. Again, the way to avoid those is to try to stay more in the independent contractor world.
So if you're willing to navigate the swamp, and I don't know who drew on our slides here, but okay, they took it away. Here are some of the things that virtual assistants can do in your practice. Benefits phones, recall, scribing, projects, letters, billing, checks, data analysis, bookkeeping, marketing, and more. They can really do almost everything your staff can do. Obviously, some of the hands-on patient care tasks are impossible, but almost anything else works with a little bit of creativity. Shout out to Joyce, a virtual assistant. She helps make the PowerPoints because I know the amount of time that I will spend moving the text around to have it exactly centered and finding the things I want, and got into a system where I can send it to someone else. So virtual assistant did this.
All right, so this is kind of my last big consideration, and as I said from the beginning, kind of what started the whole conversation between me and Bethany, and it all came to HIPAA. Well, it is a very, very big deal because if they are handling patient information, HIPAA applies no matter where they're working. So again, we have to have another question, and that is, what is your virtual assistant going to do for you? If all they're making is PowerPoint slides for you, not that that's all this one does, but I could almost hire a virtual assistant just to make PowerPoints because I do this so much. That's not a HIPAA issue. There's no involvement with patient information. They may be doing things in your office that really have no or very little exposure to any kind of patient information. I have a friend that has a virtual assistant that's basically their personal attendee. I mean, they do their vacation plans for them. They maintain their schedule and get them where they're supposed to, so those situations, maybe all you really need is a nice confidentiality agreement with them, but you're not really going to dive off into the world of HIPAA. But if they are going to be doing tasks that would expose them to management and transfer of patient information, now we're in the world of HIPAA. So if we're in the world of HIPAA and a bunch of these virtual assistants are going to end up in the world of HIPAA, then there's certain check boxes that we have to make, all very doable. And the first one would be, of course, HIPAA requires that they be trained. And of course, you want them to be trained. And so I think we said earlier, some of these companies may do some training. Some of it may be very extensive. Some of it may be more preliminary. I would strongly recommend that if you have a virtual assistant that's going to be involved with patient information, that you provide your own HIPAA training on top of whatever they've already had. That's just a really good idea. They very likely may end up being a business associate, depending on their relationship with whoever you've contracted with. You get into these subcontractor relationships. You see this, the water gets a little bit muddy sometimes, and depending on exactly what you're doing, you may not really know the answer to these. So that's when you ask somebody that does. And so again, when you dive off into this, it's not a scary place to go. Just make sure you get the right answers from the people that know what they're talking about.
So at the point you decide to do this, one of the first considerations is, how do you hire them? And so whether you're going through an agency or hiring directly, very often, just like hiring anybody here, you end up with multiple candidates. And just like hiring candidates from within your community, you get a resume that gives their experience, the things that they've done previously. Some of them will offer results of different tests. I've seen virtual assistants offer results of personality testing. One offered IQ testing, typing testing, like physical results of testing they've done or certificates they've obtained. They'll share their experience. So all of that is getting to know them on paper. One of the concerns, though, that people have, especially in a position that's going to be patient facing, they're going to be on the phone, they're going to be calling patients, or they're going to be in direct communication with the office, is that a virtual assistant from outside of the country may have English as their second language or third language. And so they want to make sure that they're going to be able to communicate with this person. And so some of the virtual assistants will send a video with their application so that you get to hear them speaking a little bit, get to see what they look like. The rules of US applications, again, don't apply. And depending on what you're looking for, I try to have communication with them beforehand so that I can get a feel for how they write. If it's going to be a position that involves written communication, I'm going to email back and forth a little bit and see how's the grammar, how's the spelling, what's their written English, what does the written English look like? I'm talking about grammar and spelling. I have always done a video interview. How are we communicating? Sometimes you get to see information about problem solving. They can't get the technology working. Zoom isn't working right away. How do they get through that and get to another platform or whatever the case may be? So once you meet somebody and you go through the process, you like their credentials, the testing is what you're looking for, you've written with them, you've spoken with them, you hire them, and then we've got to get them set up in the office. And here, this is getting their computer set up. So if you're working with a cloud-based system, you need to get your software on their computer. They may need to upgrade their internet connection if a higher connectivity than what they have is required. If you're going to be asking them to answer phone calls or make phone calls, we want to get them set with a local phone number. So there are services that you can get them a phone number they're calling from their home in another country, and it looks like it's coming from your town, or some phone systems, it looks like it's coming from your practice number. And then you want to set up a mode of communication where they're going to be able to easily talk with you or anybody on your team who they're working with.
Yeah, which leads back into, our HIPAA checkoffs. And again, if they are doing things that fall under the realm of HIPAA, then privacy and security become a big issue. Privacy you handle by training and by exposing them to the same policies and protocols that you do for your in-office employees. It's no different. But security becomes a little bit of an issue because of the remote nature of everything that we're doing. So first issue is your communication system HIPAA compliant? Because again, depending on what you're doing with them, you may be dealing with a pretty continuous live interaction. And is that communication sanctioned, or do they have a HIPAA compliant component of that? And so there's many of these out here. This is a very partial list. And more of these options know that they need to be HIPAA compliant for people to use them. So the majority are going to be. Zoom's a really good example because, I mean, to be HIPAA compliant costs these companies more. So there's no reason for them to have a product that, does PowerPoint presentations when it doesn't have anything to do with HIPAA. So they literally have something called Zoom for Healthcare, and it's constructed on a HIPAA compliant platform. And so if you're going to use Zoom, use that. Different options for different one. Skype is another one. Some of them are inherently not. And the one that I run into a lot when people have asked me about this is FaceTime, because there's so many Apple users. And that's a really interesting one, because it's not HIPAA compliant. And actually the company will refuse to sign a business associate agreement with you. So that's just a big old no is what it boils down to. But the point is, if it's not on this list, talk to someone that knows the answer, or investigate it yourself. There's plenty of options out there for compliant communication. The next issue is your connection HIPAA compliant? This gets off into the world of IT that is absolutely not my specialty, but I know enough to be dangerous. But you're going to have a communication protocol. And there's 3 basic ways to do this. A VPN is a virtual private network, and it is the safest, the most compliant, the least breakable of all these connection systems. It's more complex as well. I wouldn't even contend to even have the first idea how to set up a VPN connection. And usually you're going to have to bring IT in to help with this. But if you're looking for the safest connection, VPN literally, the way to think about it is when you have a VPN connection, they're literally like working in your office. They're working just like you're sitting in your office working on your server. They're working in their office working on your server, and it's just seamless. So that's kind of your best option. If you have an EHR and it's cloud-based, that's an automatic connection that can be, set up anywhere. That should be a encrypted, compliant connection, and certainly most all the EHR companies know this, and they are. And then the one that tends to be that gets relied on the most, because VPNs are complex and probably a bit more expensive, are remote software programs or remote control systems. And there's a bunch of them out there, and it's kind of just like, a Zoom situation. These products know that they have to be HIPAA compliant. So most all of them you run into are going to be operating on a HIPAA compliant platform. If it's not on this list, research, ask somebody that knows, but that's the next checkoff that you have. The last checkoff is, to be honest with you, probably the most complex, because their computer must be compliant. And if they're working in the office next to you, you just walk over there and you can see you set that computer up. But if it's not under your physical control, it brings in a few more issues. Anything remote, there's like a checklist, and this is a pretty good checklist for things that you must have on their machine. There's even a concept that, and I looked into this because remote workers inside the US, it's very common for the protocol to be to supply them with the computer, because you set the computer up, you know exactly what's on it, and that's a dedicated computer. That's not for their personal use. It's very clean, and you can certainly do that virtually as well. I mean, it's just a, prime delivery away. But you can run into some issues of if you need to get that computer back. So you have to think about that. There's pros and cons to that one. But the bottom line is, whether they are in your office across the street or in the Philippines, you can demand these kinds of controls. And if you're working with an IT specialist, all they have to do is log into your virtual assistant's computer, and they can see if all the checkoffs are there. It's really no different than having them in your office. So in these remote situations, you should rely very heavily on qualified IT people to make sure all of these checkoffs are happening, but they absolutely can.
So once they're all set up, the responsibility is now on you to introduce the idea to your staff, get them on board with doing this, figure out what the virtual assistant is going to do first, and then do some training. So the intro to existing staff is interesting because what we've seen is that very often the practice owner is all excited about this, and the staff members are very skeptical. And you have to remember, they're not on the Facebook pages that you're on. They're not on the webinars and the email list that you're on. So they haven't been hearing about this for months and months and months. They have heard about this very often for the first time from you. So this is a new and novel idea, and they're not sure about it. But you've got to get them sure, because the success of a virtual assistant is going to be dependent on somebody in the office giving them work, which is usually your staff. So one of the analogies that I've given to staff is to imagine a magic box. And can you imagine a magic box that you put your unfinished work into and it comes out done and done correctly? If we could produce one of those, would you like to have one? And very often with a great virtual assistant, this is exactly what's happening. Something's going out, getting done, coming back in. I have a client has a VA who's doing all of their eyeglass orders through insurance. She's doing them overnight. So at the end of the day, this practice leaves with a stack of undone orders, and they come in to a stack of packing slips on their printer, everything submitted and done. And so when they do the training to get this set up so that it's working well, it really starts to give that feel. One of the objections we hear from staff is that only takes a minute. That only takes 2 minutes. Yes, that only takes 2 minutes 30 times a day. And these things add up to hours. So you've got to figure out the initial things that they're going to do. And what I've found to be the most successful initial tasks are things that are black and white, clear, straightforward, don't require a lot of thinking or decision-making, not because they're not capable of thinking or decision-making, but because we want to get success initially. And so something that's, here's how you do it, put the patient information, the ID number in here, the authorization pops up, hit PDF or print to the office computer, and it's done, starts to help build confidence from both your team side and also from the virtual assistant side as well. We like to think of the things that are repetitious in the beginning, that you're doing the same thing by the same process over and over so that somebody can learn one process and save a whole bunch of time in the office. And that time saving is important. These are, what are the things that are taking 2 hours of your staff time at the end of every day? What are they doing that if they didn't have to do those, they would be able to focus more on the patients? So some of the things, offices, when we reopened after COVID, we're sending an email to patients before the visit. Some offices that could be automated, some it was a hit send on every single email. That's something that's, here's how you do it. It's the same task over and over. And if somebody does it besides us, it's going to save a whole lot of time. Pulling authorizations for VSP, verifying benefits, submitting an exam only to insurance, these kind of tasks. To train them, one of the critical things, and I told you that I failed miserably at this the first time that I did it, is that you have to be specific as to the process and results. So not the miserable failure, but Joyce did this PowerPoint. So the first time I said, hey, can you make a PowerPoint? And she made a lovely PowerPoint, and it had animations and graphics and things flying in and out and colors. And that's lovely. It's not my PowerPoint. I wanted the results that I want. And so to get that, you've got to be specific as to how you do it. Joe mentioned a friend who had a virtual assistant doing his personal travel. And when I used to travel more, I had that for a little while. And the first one, after hiring 4-hour work week, I said, okay, I need flights from, I'm in New Jersey. I need flights from here to wherever I was going. And he came up with a flight from JFK, and I'm not going to go to JFK. I only fly out of Newark and whatever. So when we got another virtual assistant, it was almost outlining my thought process of how I choose flights and how I choose my seat on the flight. I'm going to go for a direct flight. Here's my threshold of money where I'm willing to make a connection. I'm going to sit in the F seat in the row. I like the right side window, unless I can't get one behind row 21, in front of row 21. And in that case, I would go with the aisle seat. Like, it's teaching the process and being specific to what you want. So if you want insurance verification done and you want the results in a specific way, and you want them in this box on this page of your software, you have to say that up front, because they're not mind readers. And so they want to do a good job. They want to know what a great result looks like. And when you can show them, that's when they're able to produce it. Just like any employee, once they learn it, you have to continue to monitor it and make sure that it's being done. Virtual assistants are employees, and like employees, there are great ones, and like employees, there are some duds. And so there needs to be something in place just to make sure that things are getting done. Were these submitted? The check and balance is that this stack of packing slips is on the printer. If it's not one day, they're not doing it. Are you starting to see errors in your insurance? Maybe there's something that's not going right. And coach to success, meaning if they're doing it 90% right, they're getting the results you want, but they just aren't putting them in the right space in your program. You need to tell them. All of the virtual assistants that we've worked with have asked for and appreciated very specific feedback to take their performance from 90% great to 100% great. They say, tell me. And if you tell them, they do it. I find it's effective to give them tasks that they can own. So if they are pulling the VSP authorizations, then without, there's going to be a couple of exceptions for somebody that walks in with an outside RX or whatever, but for the most part, that's their responsibility. You're counting on them to do it. And they're not sharing where your team might do it, but they're supposed to do it if they don't have time, but they don't know if they're supposed to do it because maybe your team does it. Let them own something. And as they succeed at that, you pull up the next thing and the next, and you talk to learn what they're liking, what they're not liking, where they're struggling, just like you would with anyone else. The considerations for training an exam room scribe, and this is such a great role, is first, they've got to learn your EHR and they've got to learn your charting style. So they may be a nurse, they may be an optometrist, they may be very familiar with eye care, but they're not familiar with your program and they're not familiar with you, because every doctor charts a little bit differently. So it may be a session of here's what I say, here's what I mean when I say this, here's how I'm going to record this, here's what I write for the plan here. They can observe while you're charting, and if you're letting them see your screen, they're hearing you, seeing you, hearing the patient, sometimes seeing the patient, and in real time, they're seeing the notes that you're entering in the chart. So they're hearing what the patient is saying and learning from you how you record that. Once they start to get confident, then in our office, we have them chart into a test record. So now the doctor is seeing the patient, the doctor is charting into the patient's actual record, the scribe is charting into a test record. And after you make a little bit of time and you compare notes, here's what I wrote, here's what you wrote, you know what, that's okay. Or That's not okay. You need to write it this way. I would have written this. You can't have this. No, that was the left eye. So that's a way for you to compare. And then they start and they're doing it. And after they're starting, they're brand new. So you're looking over those charts. Ultimately, it is your signature, the OD, that goes on those charts, not the scribe signature. So you're responsible for making sure things are correct. So even when you have a very seasoned scribe, ultimately there's a double check that goes at the end for you to say, yes, this chart is complete. Any corrections are made. But over time, the corrections are less and less and less, and the time saving is tremendous. Some of the tools that we use for training, Zoom, and as Joe mentioned, Zoom for healthcare is HIPAA compliant. So being able to screen share, allow someone to have remote control of your screen. So when you're training on how to do something, you share your screen, you say, okay, watch me do it. You do it. They have any questions? Okay, I'm going to do another one. They're watching. And then you give them remote control of your screen. So they do it and you're watching their mouse move. You're seeing where they click. You're seeing where they enter so that you can make those corrections in real time. Loom, not HIPAA compliant, so you can't do it with patient information, but there's an alternate called Vidismo. Thank you, Joe, for providing that. But this is an incredible tool because you can record yourself while you're doing the work on the screen so that they can see and hear you while seeing what you're doing on the screen. It makes a short video. You can send them a link. So if you're showing, here's how we go into Eyefinity and get a VSP authorization, you can do one of them or two of them. You do them with a HIPAA compliant platform while you're doing the work. So you're doing those two and you're just talking while you're doing it. Okay, so I'm logging in here and then I put the patient information here and I click this and then this comes up and I hit this button. And now you've got a link that you can send them and they've got it for reference for as long as they want, as many times as they want to watch it. And if you lose that virtual assistant and want to train another one, it's still there. So these are the tools that we use all the time. And as they're trained and as they're working, you see what they do and you start thinking, what else can they do? And I just think it's important as they start to feel truly like that magic box, it's easy to forget that there's humans behind that computer. You come in every day, your orders are done, and you don't always think about the person who's working there overnight to do them. So I just encourage you to remember that they're people. They consider themselves part of your team, as they should, because they are. And just like other employees, they like the social aspects that go along with that. They like camaraderie. They like having a little bit of conversation, getting to know people. This weekend, 4 of our virtual assistants are getting together in Manila, the Philippines, for the first time. One of them is flying in, and they decided to get together for dinner. So we're going to virtually take them out to dinner so that they have a chance to get to meet their coworkers that they're talking to, which I think is awesome. And so when you're doing things like a special lunch for your staff or a holiday gift for your staff, it's important to include them and show your appreciation for them, just like the rest of your team. So if there are any questions, we are happy to answer questions in chat. We appreciate the interest. We appreciate any questions that are going to come. My contact information, Joe's contact information is here. And we're both happy to have you reach out to us with any additional questions. Thank you so much. We will hang out for any questions here.
Bethany, while you're waiting for questions, listening to both of us all the way through, toward the end, I just got this revelation that you got probably years ago. When I'm going through all these HIPAA checklists and you're going through all these employee training and how to treat them and all, when we started with, they're really no different than the employee in your office. If you go back through what we just said for the last 50 minutes, we said that over and over and over. You know, when you were talking about how do you train them to be a scribe, no different than what if they were in your office. The only difference is it's a virtual world, but you're doing exactly the same thing in the same way that you would have done it with anyone. So it just pounds home that they're really no different. They're just in a different space. And that's the swamp I keep talking about. But, you know, it's just an unknown. It's an unknown and it's new. And, you know, not so much for you anymore, but certainly for probably a lot of people watching, it's a very novel world that we're talking about. But to me, after listening to you talk, it's not that much different. They're just in a different place.
Yeah, it's true. And it's amazing that just like the people in your office, you get to know them and you get to care and you get to know little bits of their lives. And you know, occasionally you hear about their kids and stuff like that. So it's it's an interesting virtual world.
Bethany, can you just, be a little bit more specific as to what you're currently using your virtual assistants for? Are you doing them mostly for scribing? And also the contact information for HelloRach, if we want to contact them to start setting this up?
Yep, absolutely. I'll put the HelloRach and the information in the chat. And what they're doing in our office is we have 2 who are full-time scribes. So each of them works with one of our doctors. In addition to scribing, though, they are sending diabetic reports to the patient's primary doctor for diabetic patients. If there is a referral letter that needs to go back to a referring doctor for any reason, they are sending those. They are doing any of the follow-up that the doctor requires. So one of the doctors does a lot of myopia management. And so his scribe is keeping track of where they are in the myopia management process. Do they need to order lenses? When are they due for their annual exam, so that we don't forget that? We have one who's doing insurance verifications. So they're getting all of the patient's medical and vision insurance information before they come into the office. And we have one working on billing, insurance billing, and she's making sure that all the claims are clean so that they can get billed and paid first time out. One of ours now is training to be able to do VSP. She can currently submit VSP exams and examine contact lenses. She enters the VSP checks when they come in, and she is learning to submit VSP glasses.
Well, that's pretty much what my staff does, all that stuff. So.
Yes. Yeah. And so from a staff perspective, sometimes there's fear. Well, if they do that, what are you going to need us for? But they do that. It frees up your staff to do so many other things and take care of the patients in the office. So it's the back office work that does it. Somebody's asking, does your assistant work during your office hours? They're on the opposite side of the world. Most of our office virtual assistants do work our office hours. They are 12 hours ahead of us in the Philippines. So when we open at 9 a.m., it is 9 p.m. and they're working overnights from 9 p.m. to 5 a.m. Interestingly, most of them were looking for that when they got into virtual assisting. One of them had previously been a school nurse, and the school she was working in closed down during COVID. And during COVID, she was able to be home during the day with her daughter, who's not yet school age. And so she said, I want to work overnight so that I can be home most of the day. So for them, it's shift work. There are some that work flexible hours. The one that is doing the overnight submitting, they're working the office's overnight hours, so they're working their own daytime hours. Somebody's asked, oh, sorry, go ahead, Joe.
I just want to reiterate, because it was kind of part of that comment. You covered the staff buy off. And I can just that has to be one of the most critical parts of this whole thing. We have seen that through the years because we have a remote billing company. And when we come in, we can, and we talk to other remote billing companies, and, it's pretty universal among the billing company folks that the number one reason a billing company relationship fails is staff sabotage. It's because the staff didn't buy off, and so they were ready to take it down. And this is the same thing, because it's just logical that they see this as an intrusion, or wait a minute, I was doing that. Was I not doing a good job? So you brought somebody else in. I mean, you have to cross those, bridges to let them know that, but I have other important things for you to do. It's just, I can see it just critically important for this, just like it is for like our remote billing company. They will kill it if you don't set the stage for this to work properly.
Yeah, absolutely. And we've seen that where somebody hires a virtual assistant, the staff doesn't give them any work. They realize they're paying them to do absolutely nothing, and they stop paying them. So staff can absolutely sabotage that. A couple more questions. Somebody's asking about phones and scheduling, and they're concerned with background noise. So this is something that I would absolutely look at start to look at with a video interview. So you're making sure that somebody sounds good, that they sound professional, and also that they're sitting in a place that seems like they've set aside a workplace, which I haven't done a video interview with anyone who hasn't. But these are questions you can ask. You're going to be on the phone, so we really are going to need silence from your end. Is that going to be a problem? And they'll tell you, I live on a main street, and so sometimes an ambulance goes by, and sometimes that may happen. That probably happens in the street your office is on as well. But lots of people are using VAs for phone answering. The VAs that we've worked with have a workplace set up, and interruptions are pretty rare. One of ours, I'll ask her, can I see your daughter? Like, it's not that she's there while we're doing this. Somebody else asked about compensation. So compensation, it depends. Some of the companies that you work with have a set compensation. So Hello Rach, our sponsor, is $9.50 an hour is their standard compensation. Obviously, the virtual assistant is not getting all of that, I don't think. Hiring directly, they will tell you, they'll say required or requested salary. And when you look at these, sometimes the numbers will blow your mind. $3.74 an hour. You can give raises. So anything additional for ours, if we want to give them $1 an hour raise, we say, okay, we're not going to pay $9.50, we're going to pay $10.50. And that dollar always goes directly to the VA, as do any bonuses. So they're not taking cuts of that. Yeah, somebody is saying that they worked in a practice for many years, and since July, she's still working for the practice, even though she's moved out of state, and she can do almost everything from a laptop. This is in chat, you can read it, but it absolutely is. We had a virtual assistant for 15 years, I think, who was in Tennessee, and she was interested in working remotely because her husband was a pilot and could be moved anywhere in the country at any time. And so having a job that she could pick up and take with her was a tremendous value. And over the years, she got to where she could almost do everything in the office. When we shut down during COVID, she was the only employee still working because she was able to work from her home. She could answer phones, she could order contact lenses, she could take payments. Everything is done online. Yeah, and there are noise canceling options apparently that the people at Blue Cross Blue Shield do not take advantage of. Any other questions? Anything else? Yeah. All right. We'll hang out for a couple minutes, but thank you again. I'm going to go ahead and stop the recording, and we will have this available to anybody who wants to hear more or who missed it. Thank you, everybody, so much for listening.